Osteoarthritis, or KOA, is a chronic disease affecting nearly 240 million people worldwide. It's a leading cause of disability, especially among older adults, and brings significant personal and societal costs. People with KOA often experience pain, limited joint mobility, and muscle weakness, which can impact daily activities and overall quality of life. The risk factors are diverse, including age, weight, gender, joint structure, and occupation. As the global population ages, the number of people affected by KOA continues to rise, making effective treatment strategies more important than ever. Exercise therapy is widely recognized as the first-line treatment for knee osteoarthritis. International guidelines consistently recommend physical activity to manage KOA symptoms. Exercise helps reduce pain, improve joint function, and enhance muscle strength. There are several types of exercise therapies, each with unique benefits. These include aerobic exercises, aquatic exercises, resistance training, and mind-body practices like yoga or tai chi. While all forms can be helpful, resistance training stands out for its ability to directly target muscle weakness and joint instability, which are common in KOA. Resistance training, often called RT, involves exercises that make your muscles work against a force or weight. This type of training is commonly used in rehabilitation for musculoskeletal conditions, including KOA. RT can help strengthen muscles around the knee, improve joint stability, and reduce the load on the joint. By doing so, it slows down cartilage degeneration and eases pain. For KOA patients, resistance training is a cornerstone of non-surgical management, offering a practical way to maintain mobility and independence. There are three main types of resistance training used for KOA: isometric muscle strengthening (IMMS), isokinetic muscle strengthening (IKMS), and isotonic muscle strengthening (ITMS). Each type has its own method and benefits. IMMS involves holding a muscle contraction without movement. IKMS uses specialized equipment to maintain a constant speed during movement, and ITMS focuses on lifting or lowering weights through a range of motion. Understanding these differences is key to choosing the right approach for each patient. Recent network meta-analysis set out to compare the effects of IMMS, IKMS, and ITMS on pain, function, and quadricep strength in KOA patients. The goal was to determine which type of resistance training offers the most benefit. By analyzing data from multiple randomized controlled trials, researchers hope to provide clear guidance for clinicians and patients when selecting the best exercise strategy for knee osteoarthritis. Researchers conducted a systematic search of major medical databases, including PubMed, Cochrane Library, and others, up to September 2023. They included randomized controlled trials that compared the three types of resistance training with each other or with standard rehabilitation therapies. The main outcomes measured were pain using the visual analog scale, function using the WMAC index, and knee extension strength. This rigorous approach ensured that the findings would be both comprehensive and reliable. Meta-analysis included 12 studies with a total of 753 participants diagnosed with knee osteoarthritis. The average age of participants ranged from early 50s to early 60s, and both men and women were represented. Treatment durations varied from 3 to 8 weeks, and interventions included all three types of resistance training as well as standard rehabilitation therapies. This diverse sample helps ensure the results are applicable to a wide range of KOA patients. To ensure the reliability of the findings, researchers used the Cochrane Risk of Bias tool to assess the quality of the included studies. This tool examines factors like randomization, blinding, and data integrity. Most studies were randomized controlled trials, with some using double blinding and allocation concealment. While a few studies had missing data or unclear blinding procedures, overall, the quality was considered acceptable for drawing meaningful conclusions. When it comes to reducing pain, all three types of resistance training outperformed standard rehabilitation. However, isokinetic muscle strengthening (IKMS) showed the greatest improvement, followed closely by isotonic muscle strengthening (ITMS). Isometric muscle strengthening (IMMS) also provided significant pain relief, but to a lesser extent. These results suggest that while any resistance training is better than none, IKMS may offer the most effective pain management for KOA patients. Functional improvement is crucial for KOA patients. The WMAC index measures pain, stiffness, and physical function. In the analysis, all three resistance training types led to significant improvements compared to standard care. IKMS again ranked highest, followed by IMMS and then ITMS. This means that IKMS not only reduces pain but also helps patients regain better movement and independence in daily life. Muscle strength, especially in the quadriceps, is vital for knee stability. The study measured knee extension torque to assess muscle strength gains. Both IKMS and ITMS significantly improved strength compared to standard therapy, with IKMS showing the highest gains. IMMS also helped, but its effect was less pronounced. These findings highlight the importance of dynamic resistance exercises for building muscle strength in KOA patients. Isokinetic muscle strengthening (IKMS) stands out because it uses specialized equipment to maintain a constant speed during muscle contractions. This allows for precise control and maximal muscle recruitment throughout the movement. IKMS not only improves strength but also enhances neuromuscular adaptation, which is crucial for joint stability and function. However, the need for special equipment and higher costs can limit its accessibility for some patients. While IKMS is highly effective, not all clinics or patients have access to the necessary equipment. Isometric IMMS and isotonic ITMS muscle strengthening offer practical alternatives. IMMS involves static holds that can be done almost anywhere, making it accessible and low cost. ITMS, which involves moving weights through a range of motion, is also widely available and effective. Both methods can be tailored to individual needs and are valuable options when IKMS isn't feasible. Most studies included in the analysis had training durations of 3 to 8 weeks. While short-term improvements in pain, function, and strength were clear, the long-term effects of different resistance training types remain uncertain. More research is needed to determine how sustained these benefits are, and whether one type of training offers longer-lasting results than others. For now, regular resistance training remains a key recommendation for KOA management. Strength gains from resistance training, especially in the short term, are often due to neural adaptation rather than muscle growth. This means the nervous system becomes better at activating muscles, leading to improved strength and function. IKMS and ITMS, which involve dynamic movements, are particularly effective at promoting these neural changes. This explains why they outperform IMMS in building muscle strength for KOA patients. Conventional therapies like heat, ultrasound, and manual therapy are often used alongside resistance training. These treatments can help reduce pain and inflammation, improve mobility, and prepare the joint for exercise. However, they are generally less effective than resistance training for improving strength and function. Combining these approaches can offer comprehensive symptom relief and better outcomes for KOA patients. While the meta-analysis provides valuable insights, it also has limitations. The included studies varied in their training protocols, frequencies, and outcome measures. Some had small sample sizes or short follow-up periods, making it hard to assess long-term effects. Additionally, differences in patient characteristics and control group treatments could influence the results. More high-quality long-term studies are needed to confirm the best resistance training strategies for KOA. Clinicians and rehabilitation specialists, the findings highlight the importance of resistance training in KOA management. IKMS should be considered when equipment and resources are available, as it offers the greatest improvements in pain, function, and strength. When IKMS isn't feasible, IMMS and ITMS remain effective and accessible options. Tailoring the exercise program to each patient's needs, resources, and preferences is essential for optimal outcome. Patients understanding the benefits of different resistance training types can empower them to take an active role in their treatment. Engaging in regular resistance exercises, whether at home or in a clinic, can lead to meaningful improvements in pain, mobility, and quality of life. Patients should work closely with their healthcare providers to choose the most suitable and sustainable exercise plan for their individual situation. Looking ahead, future research should focus on the long-term effects of different resistance training modalities, optimal training protocols, and how to best combine exercise with other therapies. Larger, high-quality studies will help clarify which approaches work best for different patient groups. Advances in technology may also make IKMS more accessible, further improving outcomes for KOA patients. Summary: resistance training is a cornerstone of knee osteoarthritis management. Among the three main types, isokinetic muscle strengthening (IKMS) offers the greatest benefits for pain relief, function, and muscle strength, but all forms are effective compared to standard care. Accessibility, cost, and patient preference should guide the choice of training type. By staying active and following a tailored exercise program, KOA patients can achieve better outcomes and maintain their independence.